Unveiling the stark realities of healthcare disparities, urging a collective leap toward healing and equity. By Darius Spearman, African Elements. Support African Elements at patreon.com/AfricanElements and hear recent news in a continuous playlist during your morning commute. Plus get early access to ad-free video content. Introduction: Unveiling Racism in American Healthcare Through Legacy. The release of Dr. Uche Blackstock's legacy marks a pivotal moment in the conversation about racism in American healthcare. This book, an instant New York Times bestseller, draws from her family's multi-generational saga of Black women physicians. It exposes the deep-seated racism that shapes medical training and patient care. Source: New York Times. Furthermore, Legacy sheds light on the historical injustices that persist in modern medicine. Consequently, it ignites a crucial discourse on the need for systemic change. Dr. Blackstock's narrative intertwines personal experiences with professional insights, offering a unique lens through which to view these issues. Importantly, the book acts as both a mirror and a map. It reflects the ingrained biases within the healthcare system and charts a path toward equity. Source: Harvard Health Publishing. In Legacy, I delve into the personal and the systemic, revealing how racism infiltrates every aspect of healthcare, Dr. Blackstock explains. Source: The Guardian. Thus, Legacy serves as a critical tool for understanding and dismantling the barriers to fair medical treatment in America. The historical roots of racial disparities in medicine. The inception of racial disparities in American medicine traces back to profound historical events. The ban on the importation of enslaved people in 1808 heightened the value of existing enslaved populations in the U.S. This economic shift spurred medical experimentation on enslaved women, laying a foundation for racial biases in medical practice. Notably, Dr. J. Marion Sims, recognized for advancing obstetrics and gynecology, conducted surgical experiments on enslaved women without anesthesia, based on the false belief that Black individuals had a higher pain tolerance. These unethical practices contributed to a legacy of racial bias in pain perception and treatment. Source: KFF. Additionally, the history of African Americans in organized medicine reveals a long-standing pattern of segregation and racism. This history, often overlooked, significantly impacts historically marginalized communities and continues to influence the medical profession today. Efforts to acknowledge and reconcile past discrimination have been initiated, but the path towards equity remains extensive. Source: American Medical Association. In every dimension of healthcare, racial inequity persists, deeply rooted in both interpersonal and institutional racism. Examples abound, including biases in medical education and the under-resourcing of hospitals in majority Black neighborhoods due to historical policies like redlining. Such disparities highlight the critical need for systemic change in healthcare to address these injustices. Source: Smithsonian Magazine. The collective history of racial disparities in medicine serves as a stark reminder of the need for continued vigilance and action towards achieving healthcare equity. By understanding and confronting these historical roots, we can begin to dismantle the barriers that perpetuate inequities in health and wellness. Systemic biases in medical training and patient care. Systemic biases in medical training and patient care significantly impact the quality and equity of healthcare delivery. The American Medical Association, AMA, has adopted guidelines to confront systemic racism within medicine. These guidelines aim to address discrimination, bias, and abuse, including microaggressions, by recommending healthcare organizations establish policies promoting cultural change and ensuring a safe, discrimination-free work environment. The AMA emphasizes that systemic racism is a major barrier to health equity and appropriate medical care. Source: American Medical Association. Moreover, unconscious bias in healthcare can discriminate against patients and affect their care. Assumptions based on age, race, sexual orientation, or religion, often unconscious, can lead to erroneous clinical decisions. This bias, also known as implicit bias, is significant because it may influence decision-making regarding patient care. Efforts to tackle this issue include more research, awareness, training, and the promotion of diverse teams. Source: the BMJ. These biases lead to valuing some groups over others, based on factors such as ethnicity, gender, and disability, all of which play a critical role in patient care. Both healthcare professionals and patients possess unconscious biases, affecting the patient-doctor relationship. Addressing these biases is essential for equitable care delivery and improving patient outcomes. The introduction of guidelines by the AMA and the recognition of unconscious bias in healthcare underscore the necessity of confronting these issues head-on. By doing so, the medical community can work towards a healthcare system that offers equitable treatment to all patients, regardless of their background. The Power of Personal Narratives, Dr. Blackstock's Family Legacy. Dr. Uche Blackstock's legacy intertwines personal narrative with a critical examination of racism in medicine, presenting a compelling case for systemic change. Her story, deeply rooted in her family's experience, sheds light on the enduring racial disparities within the U.S. healthcare system. Legacy is not only a memoir but a call to action, aiming to foster a more equitable healthcare system for people of color, particularly Black women. Source: Essence. The book highlights the stark underrepresentation of Black women in medicine, where less than 3% of physicians are Black women, and only 0.8% of full professors at U.S. medical schools in 2020 were Black women. Dr. Blackstock and her twin sister, Oni, growing up in Brooklyn, New York, never doubted they would become physicians, eventually becoming the first Black mother-daughter legacies from Harvard Medical School. Through her personal journey, Dr. Blackstock emphasizes the importance of representation and the positive impact it can have on reducing racial health inequities. Source: Essence. In Legacy, Dr. Blackstock offers a unique perspective, blending her professional insights as a Black physician with her personal experiences as a patient and a Black woman in America. The book was motivated by the COVID-19 pandemic, which exposed significant flaws in the healthcare system, particularly its failure to serve Black communities adequately. Dr. Blackstock's narrative is a powerful reminder of the systemic racism embedded in healthcare and its effects on patient care and outcomes. She urges not only Black health professionals but also white health professionals to confront their biases and work towards dismantling the structural barriers that perpetuate health disparities. Source: Essence. Legacy is a testament to the power of personal narratives in highlighting systemic issues and mobilizing change. Dr. Blackstock's account, while deeply personal, underscores the broader implications of racism in medicine, advocating for significant investment in Black communities to address the social determinants of health. Her book is a critical contribution to the ongoing dialogue about health equity and the need for systemic reform to ensure that all individuals, regardless of race, have access to quality health care. Source: Kirkus Reviews. Toward a Future of Equity, Solutions and Calls to Action. The path to achieving equity in healthcare is multifaceted, requiring a comprehensive approach that addresses systemic racism, improves access to care, and enhances the diversity of the healthcare workforce. Institutions like Harvard Public Health and initiatives spearheaded by organizations such as the National Institute on Minority Health and Health Disparities are leading the charge by implementing programs aimed at increasing equity and reducing bias in healthcare settings. Source: Harvard Public Health. Improving diversity in clinical trials. Efforts to improve diversity in clinical trials, such as those by Genentech, have shown promising results. By conducting trials in facilities serving underrepresented populations, the participation of Black, Hispanic, Native American, and other historically underrepresented groups in clinical trials saw significant increases. Additionally, programs like those from the Lazarex Cancer Foundation, which reimburses patients for transportation and housing costs, are crucial in overcoming logistical barriers to clinical trial participation. Source: Harvard Public Health. Expanding health insurance coverage. Expanding health insurance coverage is vital for improving access to health care for racial and ethnic minority groups. The Kaiser Family Foundation highlights the importance of insurance in ensuring individuals receive necessary medical care and reducing disparities in access to quality care. Efforts to expand Medicaid and other sources of coverage are particularly crucial for racial/ethnic minority groups who are disproportionately represented among the uninsured. Source: KFF. Increasing provider diversity and capacity in underserved communities. Strengthening the capacity and increasing the number of providers in underserved communities is essential for addressing health disparities. Initiatives like More in Common, a collaboration between Morehouse School of Medicine and Common Spirit Health, aim to train more culturally competent providers and expand research on diseases disproportionately affecting African Americans. Such efforts not only improve access to care but also contribute to better health outcomes for minority populations. Source: Harvard Public Health. Leveraging data to drive improvement. The Commonwealth Fund's approach to achieving racial and ethnic equity in U.S. healthcare emphasizes the importance of data. By calculating standardized scores for state health system performance across different racial and ethnic groups, this method allows for the identification of disparities and areas needing improvement. Such data-driven approaches enable targeted interventions and policies aimed at reducing inequities. Source: Commonwealth Fund. In summary, addressing the deep-rooted issues of racial and ethnic disparities in healthcare requires a multifaceted strategy that includes enhancing diversity in clinical trials, expanding health insurance coverage, increasing the number and capacity of providers in underserved areas, and leveraging data to drive systemic improvements. Through concerted efforts across these domains, the goal of a more equitable healthcare system can be realized. About the author. Darius Spearman is a professor of Black Studies at San Diego City College, where he has been pursuing his love of teaching since 2007. He is the author of several books, including Between the Color Lines, A History of African Americans on the California Frontier through 1890. See more Black news and history content at africanelements.org.